Assalamu alaikum students. Today we are going to start the upper extremity of the appendicular skeleton. In this video we will learn about the humerus bone, which makes ball and socket joint. So to form the ball and socket joint, the rounded head of the humerus articulates with the glenoid cavity of the scapula and makes the glenohumeral joint. The upper head is rounded. It is directed medially, upward and backward, and the lower end is expanded from side to side. Now we will determine the side of the bone. To determine the side of the bone, the head of the humerus should face medial side of the body. The anterior border of the shaft should face the front side of the bone, and the medial epicondyle of the humerus should face the medial side of the body. So through this we can understand that this is the right side of the humerus bone, because the head is facing medially, the anterior border of the shaft is facing towards the front of the body, and the medial epicondyle is facing the medial side of the body. Now we will discuss about the features of the humerus bone. The humerus bone is divided into the upper end, the shaft, and the lower end. Now we will discuss about the upper end of the humerus bone. The humerus bone has a head facing medially. It is present medially, upward and backward. There are two tubercles, the lesser tubercle and the greater tubercle. The lesser tubercle is present on the medial side of the body, and the greater tubercle is facing on the lateral side of the body. To divide the lesser and greater tubercle, there is the bicipital groove or intertubercle sulcus is present. To divide the head of the upper end from the other part of the upper end, there is the anatomical neck is present. Now we will discuss about the division of the upper end from the shaft. To divide the upper end from the shaft of the bone, there is the surgical neck which is present. 0.5 centimeter above the surgical neck, there is morphological neck is present. Now we are going to discuss about the shaft of the humerus bone. The shaft of the humerus bone is divided into 3 borders and 3 surfaces. Now we will discuss about the borders of the humerus bone. There are 3 borders, as we know. So this is the medial border of the humerus bone, and this is the anterior border of the humerus bone. This is the lateral border of the humerus bone. In the medial border, if we go upward, there is the medial lip of the intertubercle sulcus, and the lateral lip of the intertubercle sulcus is present at the anterior border of the humerus bone. In the middle part of the upper one-third, there is the deltoid tuberosity. If we come towards the lower part of the shaft, there is the lateral border, which is prominent only in the lower region, and on its lateral side it forms the supracondylar ridge, and on its medial side it forms the medial supracondylar ridge. There are three surfaces of the humerus bone: the anterior surface, the posterior surface, and the lateral surface. The anterior surface is present between the anterior and the lateral side of the humerus bone. Anterior and lateral border of the humerus bone. The medial surface is present between the anterior border and the medial border of the humerus bone. This is the medial surface. This is the lateral surface. And now if we talk about the posterior surface of the humerus bone, this is present between the medial and the lateral, the medial and the lateral part of the humerus bone. So this is the posterior surface of the humerus bone on the posterior side of the humerus. This is the lower head of the humerus. The lower head of the humerus has the condyles in it, which has the articular and non-articular surfaces. This is the trochlea and this is the capitulum. The capitulum articulates with the rounded head of the radius, and the trochlea articulates with the ulna, the trochlear notch of the ulna. This is the medial epicondyle, which is the non-articular surface, and this is the lateral epicondyle, which is the non-articular surface. The medial epicondyle is larger as comparison to the lateral epicondyle. Above the lateral epicondyle we have lateral supracondylar ridge, and above the medial supracondyle we have above the medial epicondyle we have the medial supracondylar ridge. Above the trochlear condyle we have the condylar fossa. And if we turn the bone, and this is the posterior side of the bone, and on the posterior side above the trochlear condyle we have the olecranon fossa. So this is about the humerus bone. So if you want to learn about the muscle attachment of the humerus bone, so please tell me in the comment section below, and please, if you found my content helpful, so please like, share and subscribe my videos. Thank you.